figures have revealed that around 36,000 cancer appointments have been cancelled because of NHS strikes. Maybe you're not surprised. Charities are describing the disruption to care as concerning, and they're calling for an urgent end to industrial action. This comes ahead of the first ever joint strike by junior doctors and consultants, which starts next week. Talk Radio's political editor Peter Cardwell still here. Thanks, Peter. And we're joined by former Labour advisor Mike Buckley. Hello, Mike. Thank you so much for coming in.
Hello.
Now, the reason that we're party to this information, and we know about the 36,000 cancelled appointments, is because of a bit of gutsy investigation by the Labour Party.
They've done a great job of using the Freedom of Information system to find out how many appointments, and I think they've had to go through lots of records of different trusts across the country, of course. And the number that has been revealed, 36,000, I mean, it's staggering. That's 36,000 lives. I mean, charities saying it's concerning, I think that's incredibly restrained.
The word concerning is
I mean, imagine if it was yourself. Imagine if it was a family member who's you're waiting for this incredibly important diagnosis or treatment, possibly. Your or your family member's life is at stake. The last thing you want is for it to be deferred. Now, of course, understandable for some people to blame junior doctors or nurses or indeed or consultants for these things being put back. But these strikes have been going on for a long time. The government, as we know, are refusing to negotiate. They're refusing to even entertain the idea they might need to pay more money, even though salaries here are way below where they are elsewhere. You know, even in the EU, never mind Australia or New Zealand. And we've all heard the stories of people upping sticks, moving to Australia, moving to Ireland even, finding out they can work fewer hours, get paid loads more money, have a better life. Why wouldn't people do that? So it's no wonder that doctors here are saying we don't want parity with those countries, but we at least want some recognition of the fact that we're earning a lot less. And inflation's sky high.
But didn't doctors also say, very emphatically, but to me on this programme and all over the place, that actually, you know, appointments weren't going to be missed, you know, operations were not going to be delayed, there was a kind of excellent staff covering, you know, matters that were pertaining to anything urgent, and actually this kind of scenario was not going to come about. Weren't we promised by junior hospital doctors particularly that there wasn't going to be a residue of cancelled appointments like this?
I mean, a good friend of mine works in the health service. She's a midwife, and the way she describes it is that they've had multiple Christmas days. So Christmas Day, obviously, is the one day in the year when coverage is minimal. Skeleton service. And as we all know from friends and family who are in over the weekend, if you're even in a weekend when there's less service, people can be in trouble and bad things can happen. Christmas Day, of course, is even worse. That happening recurrently every time there's a strike, that is, of course, going to have an impact on the health of the nation. Now, we all know people in the health service. We know that these people, they're mortified. They go into this profession to save lives. But equally, they've got to the end of the road. I mean, this is happening across many different sectors. I mean, the rail industry is another one. You know, it was the postal industry last year. There have been many of these things. They've got to the end of the road. People's salaries have been whittled away, you know, by 30, 35, 45% since 2010, often in the public sector, because wages have gone down, inflation's gone up. People have just got to the point where they can't pay the bills anymore. It's just understandable that they're drawing a line under it.
I mean, obviously, Peter, the picture being painted is a valid one and a very vivid one, and also an extremely sort of chastening one. 36,000 people, as you quite rightly say, who thought they were going to go and get their radiotherapy or their diagnosis or their mammogram, or they thought they were going to start their chemotherapy, whatever it was they thought was going to happen, hasn't happened. Now, these are people, you know, with cancer. That used to be the disease that didn't even speak its name because people were so terrified by it. So what you need, everybody knows, when you have a diagnosis like that is, you know, treatment must be expedited. You go straight to the top of the list. It has to happen immediately. It has to happen, you know, speedily, and there has to be a great deal of heat behind it from the medical team of oncologists who are supporting you through. Well, if they're on strike, as we've now seen, they're not doing that. So where is the bit where the government steps in with great urgency, feeling that these statistics, which have now been revealed, are frightening, shaming, you know, discombobulating for people, and as you quite rightly say, affecting 36,000 families in the country?
I'm not sure it's entirely the government's fault, although clearly they should be talking to the medical unions in a way that they're not already. But the fact that there are people who say they don't want to do any harm, I mean, they are doing harm by striking. Their strike may be totally legitimate. People can make their own minds up about that. But they are nonetheless harming people's care. That is factual. There are 36,000 people who haven't had those cancer appointments. Also, you've got the backlog of the COVID lockdowns for a long time. People people were told essentially don't bother the NHS if you don't have to, essentially. So there are a lot of people. There are one person in every 3 households in England anyway is on an NHS waiting list. Cancer is the sharp end of it, but there are lots of other ends as well. There are lots of other aspects of this. There are people who are in a great deal of pain today.
Yeah, absolutely. That's crucial. There'll be people
they're on
living with
waiting lists, and there are people,
pain. Yes.
and there are doctors striking who, if they weren't on strike for whatever reason, you can go into the whys and wherefores of that, but if they were not on strike, then people would be better. That is factual. So the problem for both the unions and the government as well, and of course, you've got consultants, many of whom are on salaries in excess of £100,000, far more than many of the patients who are on these waiting lists. The average salary in this country is £31,000 a year. They are making a choice to withdraw their labour. That, as I say, the whys and wherefores of that we can go into. That's up to people to decide whether that's right or not. But who people blame in this, whether they blame the government, whether they blame NHS England, which is an independent body which is supposed to deal with these pay disputes, or whether they blame the people who are on strike themselves and say it's time to get back to work. You've made your point. You're not getting anywhere. Time to let go. Well, that's a big question for all 3 of those groups, as well as the patients themselves.
So, Mike, do you think that the government is being unfairly castigated here? They can't wave a magic wand? They've tried?
No, not at all. I mean, if you think about the bigger context, there are 7.6 million people in this country waiting for NHS treatment. The vast majority of that backlog was built up before the pandemic. Yeah. The government keeps saying, oh, it's all because of COVID. It is not all because of COVID. It was mostly due to the 9 years before that, 10 years before that, since they came in 2010. When they came into office, waiting lists were at near zero. We've all seen the graph. It went up under Thatcher and Major, down under Blair and Brown. It's gone up again under the multiple prime ministers we've had since, and it's now at stratospheric levels. Yes, in part worsened by the pandemic, but it's mostly underfunding, it's mostly understaffing, taking away the nurses' bursary, so people stop going into nursing training. It's government failure. So the vast majority of this is them. In part, yes, it's people withdrawing their labour right now. But as we've said, people at the end of their tether, trying to pay a mortgage, trying to feed their kids, trying to get on with their lives.